Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca.
Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. This month, the Spark theme relates to child health research, and I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin and Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made in shaping and strengthening this community, our province, and the country. Today, during Child Health Research Month, we're delighted to invite Karen LeGrow to speak on home care for kids with complex needs, parents and provider experiences. But before we begin, we'd like to invite you to answer a few quick questions for us. Please note that we'll pop up a poll here now, and you'll have to answer all three questions in order to submit your responses. So type away. While you're working on the polls, I'd like to introduce our speaker for today. Dr. Karen LeGrow is Associate Professor in the Daphne Cockwell School of Nursing, Faculty of Community Services at Ryerson University. Her expertise in the areas of high-risk neonatal pediatric nursing and family nurse relational practice. The major foci of Dr. LeGrow's program of research is to develop and nurture an innovative program that critically examines the specific mechanisms by which place affects health and how it influences parent healthcare provider relational care practices, specifically for children with complex healthcare needs across the continuum of care. Just a reminder that we record all of our webinars, and as mentioned in the introductory video, please type your questions into the question box at any time. I'll prompt you via the chat as well, and I'll pose the questions to Dr. LeGrow at the end of the presentation. It's now my pleasure to pass the mic to Dr. Karen LeGrow.
I am certainly very excited to be here today and have a conversation with the audience around the work that I've been doing with my team. And we would like to introduce you, welcome you, and share with you our latest study related to home care for kids with complex needs, parent and provider experiences during COVID-19. And I am the principal investigator for this study, but I am no means the only person on my team. And I'm representing my team for this study, which I will share with you in a second. Before I share details of the study with you, I'd like to take a few minutes to highlight for you the members of our international and disciplinary research team. We are a diverse group of researchers, clinicians, and educators from 3 countries representing various organizations and institutions. We represent from Canada, Ireland, and Northern Ireland. From Ryerson University, Sick Kids Hospital, VHA Homecare, as well as colleagues from University College Dublin and Queen's University in Belfast. We also would like to acknowledge the work of Taylor McLean from the Centre for Creating Knowledge at Ryerson University for developing and designing our logo, our social media, our recruitment materials, and for development of our online survey. We also felt very strongly that we could not do this this study without engaging with families and parents. So therefore, we would like to acknowledge the members of the family advisory group that was created for this study. We felt very strongly that this was essential as we moved forward on this journey. Therefore, we established an advisory group that consisted of 4 parents of a child with a rare disease and/or complex care needs who engaged with the research team on a regular basis as they were able to provide feedback and expertise and inform key elements of the study. These activities involved facilitating the development of and feedback on survey questions, strategies to enhance recruitment, as well as development and feedback on interview questions for an interview guide. And the items in yellow are those that are going to be coming up in as we work through this particular project. Certainly looking to engage families to co-develop policy recommendations and practice guidelines, as well as help us create ideas for knowledge translation and dissemination. And as you know, with any research study, there is REB approvals and funding that is needed. And I'm just sharing with you an overview. We have also received ethical approvals from all the appropriate research ethic boards and committees in the various countries, as well as we've also secured various funding awards, both external and internal, to support our study in our respective countries, such as the Norman Saunders Complex Care Grant from the Hospital for Sick Children, which has been our main source of funding, as well as in-kind support from Ryerson University to hire research assistants, as well as a summer student internship at the University College Dublin. We are happy to share that our team was supported we are happy to share that our team has supported and mentored 4 students over the course of this project, 1 postdoc, 1 graduate, and 2 undergraduate students. So children with rare diseases and/or complex care needs have multiple ongoing complex health and developmental issues that place substantial demands on various specialty pediatric services, healthcare sectors, and care settings over their lifespan, and consequently are some of the most vulnerable members of society. Ordinarily, these children rely on tremendous levels of frequent professional, home care, and family support, 24 hours a day, 7 days a week, to allow them to remain safely at home. However, COVID-19, as an unprecedented public health emergency that has emerged globally, and as a result, it has disrupted the life of every child and family, especially families of children with rare diseases and/or complex care needs. As a result, this pandemic has placed these children and their family caregivers, who they rely on 24/7 for extraordinary care needs, highly vulnerable to contracting and transmitting COVID-19. Knowledge of this, combined with the systemic marginalization of this population, who depend on the home care sector for their child's safety and caregiving respite, places immense added pressure on families of children living with rare diseases and/or complex care needs to manage their extraordinary care at home. Public health recommendations during the first and second wave of COVID-19 to stay at home and quarantine and/or cocoon for several weeks and maintain physical distancing is extremely challenging for children requiring multiple clinic, specialists, and home care visits. Therefore, we were curious about how were these challenges addressed in the home care system in the early pandemic-related response, and what measures were put in place to ensure safe and continued pediatric home care provision for families of children with rare and/or complex care needs. And therefore, our research objective was to examine the impact of current policies on the delivery of home care practices and services during COVID-19 for families of children with rare diseases and/or complex care needs who are currently receiving home care services, with a goal to ultimately develop policy recommendations and practice guidelines that would inform current and future home healthcare services and systems during the global pandemic. As a result, a multi-phase study using a combination of qualitative and quantitative data sources is currently underway. And the phases are as follows. There's a total of 3 phases to the study. The phases 1 and 2 in blue have been completed or are underway, and phase 3 will be taking place in the coming year. So the phase one was a web-based survey where we developed a knowledge user-informed survey specifically created for the study to document home care policies, practices, changes implemented, and directives instituted during COVID-19, and to solicit responses about home care received, challenges experienced, barriers and enablers to home care delivery, and impact on family and healthcare and service providers during the COVID-19 pandemic. We are currently in phase two of this particular study, where we have conducted interviews with a subset of families, home healthcare practitioners, and home healthcare service provider agencies to really explore and drill down into key findings from the survey and provide a rich context from which to review the data. And as I indicated, phase three will be upcoming later in the year. Our sample was a convenient cross-sectional sampling framework, which we used to recruit eligible participants from our respective countries. The sample included families of children with a rare disease and or complex care needs who were receiving and or put on hold home care services, and their respective home healthcare providers who supported care and services in the home. Inclusion criteria for families of children with rare diseases and or complex care needs were families of children from birth to 16 years of age whose child was diagnosed with a rare disease and or who was considered medically complex. The family resided within the participating countries and the parents read and spoke English. Data analysis plan, for all quantitative data collected from the web-based survey, was analyzed using descriptive statistics, and all qualitative open textual responses collected by surveys underwent content analysis. So here are some descriptive statistics of the cohorts from the phase one of our phase one data. This table highlights the gender, age, and country of residence of participants. The majority of participants, both parents and healthcare practitioners, were female, and both cohorts were very similar in age, with a mean of 42.5 for healthcare practitioners and 42.3 for parents, with the range slightly higher in family caregiving cohort. And there was a balanced representation, certainly from Canada and Ireland, with a smaller number of participants from Northern Ireland. When we look at the variety of healthcare practitioners who participated in the survey, certainly the largest group of participants were from nursing, with occupational therapy, physiotherapy, with smaller representation. So when we look at the family child characteristics, most family participants were parents who indicated they had one child requiring children's home care services and support, with a smaller percentage having two children, both requiring home care services. More than half of the children were male, with a smaller percentage identified as female, and the mean age was 9.25 years of age, with a range of 1 to 18 years of age. When we look at the children for which parents were completing the survey, 100% of parents reported that their child required heightened supervision, with an 83.6% indicating that their child required the supervision from 12 to 24 hours a day, every day. This cohort of children generally required support with toileting, eating, mobility, communication, and breathing. And the various sort of cares and therapies are listed with each category. So now I want to share with you the results, the preliminary results for the phase one data. And this is purely Canadian data. I've separated out the Canadian data from the larger cohort of data. And for Canada, the parent participants represented parents from Ontario, Alberta, BC, Quebec, and Nova Scotia. And the healthcare participants represented Ontario, Nova Scotia, Alberta, Quebec, and BC. And what we found was that the COVID-19 and its ramifications led to a disruption in healthcare services, especially home care, that necessitated changes in home and work routines, which then had a significant impact on the health of children and families and their important relationships. So now I'm going to go into each of these categories in a little bit more detail. So many families went into isolation and cocooning at home, thereby shielding themselves from others. And as a result, services were impacted. Parents reported that they received less services during COVID than they did pre-COVID, with a reduction of 40% reduction in nursing support and services, 50% less reduction in PTOT, and 25% reduction in respiratory therapy. And families reported a lack of services, that there was no therapies, no respite, no support, which really led to increased family responsibilities, increased stress, anxiety, and distress. They reported no regular checkups or a delay in their usual care and therapies, and the parents felt that their child regressed in many ways. It's also important to note that 55% of families declined home care services outright. And the reason for doing so was that 91% did not want outsiders coming into the home. And 46% of the nurses who were caring for the children also worked in multiple sectors and didn't want that crossover between nurses coming into their home who were also in other sectors of the healthcare system. There were also indications of reports of personal protective equipment and equipment for the home and supplies that were identified as a concern. 40% of families reported that they did not have access to sufficient supplies of PPE, and 35% felt that their healthcare provider did not have enough PPE to carry out their responsibilities. Families also reported delays in equipment deliveries and accessibility, and a lack of availability of specialized equipment for the home. When families were asked about receiving information around COVID-19, that a majority of families stated having access to COVID-19 information, particularly from government websites, news programs, and social media. However, 50% of families reported that they did not have access to specific information, such as infection control advice, with 55% of parents reporting that they did not feel the healthcare provider communicated safety protocols for the home. Parents were also asked about virtual healthcare and virtual home care visits. And parents reported challenges with availability and accessibility. However, 70% of families had an opportunity to receive virtual home care visits. And of those that received these visits, 80% of families felt that they were very helpful. For the 30% of families that did not have the opportunity to receive a virtual visit, 50% of those would have liked to have received one. So certainly COVID brought about many changes in the home, and certainly one of those was changes in home and work routines. And both families and healthcare practitioners identified their important aspects of their experiences. So when we think about changes in home and work routines, COVID necessitated changes in activities of daily living and usual routines, balancing multiple roles and responsibilities, and required alterations in work and practice patterns and workload. Certainly from families, they reported a major disruption to their daily routines. They needed to adjust to multiple schedules to accommodate caring for their child who was receiving home care 24/7, but also their other children. So it meant balancing home, work, childcare, and everything else that involves. Families reported needing to remain vigilant with COVID screenings of anyone coming into their home, hand washing and mask wearing. And certainly for those families where there was no their child received support in school, there was no school support and there was a lack of remote learning. One parent stated that they needed to hunker down and survive, while another stated, "I just continued what I was doing, but it became more stressful with no breaks or relief. I couldn't leave the house to go grocery shopping. It has been exhausting." When we think of healthcare practitioners, certainly working from home brought its own concerns. Healthcare practitioners reported switching between home and work mode constantly, that there was no longer set work times, and that they were making frequent phone calls and responding to emails outside of usual work hours. that they also needed to adjust to multiple schedules to accommodate their own children and also provide support and services to their children in their caseload, as well as balancing, similar to families, home, work, and childcare as well. They also reported needing to become quite familiar and comfortable with virtual care quite quickly and navigating care processes in an alternate delivery method, and therefore felt that they had educational needs that might not always have been addressed. They reported having a higher caseload in that they were answering more emails, more phone calls, there was more paperwork, and they felt there was a higher demand on their time, and they felt isolated from peers and colleagues. And one healthcare practitioner stated, "Families are more stressed with higher demands on me. I find myself doing even more advocacy and whole health tasks than before." So when we think of health, it's obviously mental, physical, emotional, and social aspects of our well-being. And certainly the fear of contracting and or transmitting COVID-19 and passing it on to others was the most concerning for parents and healthcare practitioners. Fear, certainly for parents, it was fear of their fear for their child and themselves, or for their families contracting and COVID and passing it on to others in their family. The fear of home care practitioner bringing COVID-19 into the home, and especially for families, the fear of dying and leaving their child without a parent. Families reported feeling lonely and isolated, feelings of being discarded and forgotten, worrying about the only support for their child because there was no support. And it was impossible to do this all alone. They felt overwhelmed. And one parent stating, "I was terrified." Parents reported feeling physically exhausted, tired all the time, highly stressed and anxious, consistent and constant worry, and fear of what could happen if their child got ill. One parent stated, "It took a serious toll on my mental health, and physically the stress led to more depressive days." For healthcare practitioners, certainly there was the balance between being careful and following infection control guidance, but not becoming overly anxious. They expressed feeling extra pressure and responsibility, feelings of feeling burnt out, and that affected their mood and well-being. They were not sleeping well and having feelings of being socially isolated from their peers. They reported being physically tired and overwhelmed with the extra responsibility, and that they felt stressed and distressed because they knew that families were struggling. And then ultimately, we talk about the impact and effect on relationships. Certainly for families, it was their relationship with their home healthcare provider, and that the change in practitioner affected services received, that new staff had to learn about their child and understand their needs, which took time. And therefore, consequently, parents needed to repeat the same information over and over again. And certainly managing different opinions and perceptions was challenging at times. If the family and the healthcare provider were new in their working relationship, parents and healthcare providers reported that the switch to virtual care certainly affected the establishment and further nurturing of that relationship. And that families reported they were not comfortable enforcing proper use of PPE by healthcare practitioners in their home. For healthcare practitioners, their experience affected their relationships with the parent and children that they supported in the home, as well as the members of the interprofessional team that they worked with. Certainly, they felt that there were real barriers between themselves and families, a kind of a sterile environment, and it did not have the comfort as before. And the healthcare practitioner felt like they could not give the families 100%. In relation to teamwork, it was more difficult to collaborate and to communicate and to access support when needed. So I know that this is a very quick and high-level summary of the results, but certainly the ramifications of COVID-19 and the impact it has had on children with complex healthcare needs in their families are significant. We are currently completing phase 2 of the study and analyzing interview data from parents, home health care practitioners, and home healthcare practitioner agencies from participants from Canada, Ireland, and Northern Ireland. And our team is committed to engaging with our family advisory group and other key partners and stakeholders to develop policy recommendations and practice guidelines to optimize home care services for this population of children and their families so that we can mitigate the impact of COVID-19 and other future pandemics. This is just some of the key references that were used for this particular presentation, but certainly I've put my Ryerson email address here. I am on Twitter and sharing a number of recent publications that speaks to relational practices within a home care context for children with complex continuing care needs. So I think I will stop sharing now, I believe, and then open it up for questions. And I do apologize again for the technical difficulties.
Not to worry, Karen. We're going to, I'm just compiling the questions here. And while we're doing that, Jose is going to issue another poll. And you have to answer all the questions in order to submit the poll answer. So, Karen, Tamara asks, first of all, Karen, thank you so much for a great presentation. There's a number of comments in the chat box that we can share with you, positive comments about your research. And then we have multiple questions, so I'll just keep going. So Tamara asks, did you specify the definition of pediatric complex care needs for your work? And if so, what was it?
Thank you for that question. Yes, we did. In the survey, we asked the participants to indicate that they that their child was receiving home care services and to meet certain sort of criteria. So they had to obviously identify the services that they were receiving, as well as the child's complex care needs. We also had a criteria listed, and the parents would indicate if their child fell under that particular category. I do have the criteria here that I can list out for you. I didn't for the space of time, so just bear with me for 1 second, and I will read it out to you.
While you're looking that up, Karen, yeah. I'll remind folks that some of your questions have been answered in the chat box by Krista. I see a couple of raised hands when we get there.
Thanks, Krista. So when I say that a child has been diagnosed with a rare disease and or who is considered medically complex, where the child has complex care needs requiring the use of medical devices to compensate for a loss of a vital body function that necessitates considerable medical care and assistance with activities of daily living, which is provided by a combination of unpaid caregivers, family members, nurses, multiple healthcare professionals, and or a paid attendant. So that was the kind of criteria we used.
Perfect. Karen asks, for nursing, were they healthcare aides, LPNs, RNs? What's the classification of nursing that you saw in your study?
That's a good question. We didn't ask specifically what kind of nursing. We just identified as nursing, PSW, and then the list of the providers that you saw on the chart.
Oh, great.
Yeah, we didn't specifically specify.
Susan asks, were the clients only those followed by the complex care teams? And what about those who are complex but not followed by those teams?
No, it was not only being followed by a complex care team. We sent out the invitation for the web-based survey on social media and through our professional networking partners. So it could have been any parent who was caring for a child in the circumstances that we were indicating.
Sandy had asked what was meant by virtual home care, and there's suggestions provided in the chat box. And then Susan went on to say, are there any innovations for the future from a virtual healthcare perspective that perhaps were suggested through the study?
That's a really good question. I think that's one that we will be thinking about and considering as we move forward. Certainly, we didn't get any specific information from participants, as this was only I won't say only, it was a web-based survey with questions, open-ended and closed-ended questions. I think when we look at our data from our interviews, which we're doing right now, we will probably get more of those kinds of that kind of information. But certainly that is something that we will certainly be interested in and wanting to contemplate and to consider. But no, we didn't get any specific suggestions.
So Susan has her hand raised. I'm going to allow Susan to ask her question verbally. Go ahead, Susan.
Oh,
I think Susan, you're muted.
sorry, can you hear me now?
We can.
Yeah, no, great. Really appreciate your research, and certainly have been very involved in sort of COVID and sort of the impact on these individuals, as well as those who've transitioned into adulthood. Mm-hmm. So I'm really, I thought some of it was interesting. As I listened to some of it, there was a lot of the downsides, and I know COVID, there is a lot of downsides, but I guess for me with my rose-colored glasses, I'm always thinking about what is that future innovation and
mm-hmm.
And thinking about care. I just think that there was a lot of lessons we learned
mm-hmm.
in terms of, is an opportunity for sort of a mixed model, sort of some virtual, some in person. Like some of the visits, I think now I really question, why do they need to go? When I think of the transportation cost to get some of these complex kids to the hospital for a blood test or, for an exam. So really sort of looking at what is the criteria for the future versus in person versus virtual. And then understanding then, I think we need to do better at sort of how we actually provide home care in the future when we have these situations, because I think the families that, had the total accountability for their care at home and lost that support,
mm-hmm.
it's been devastating. And what I see is some families are now, they're really starting to think about, do I need a different approach? They're
mm-hmm.
really tired and worn out, which I think it's a little bit disheartening to hear, because they may want to look at residential care, because I think the last 2 years have really, taken a lot out of families.
Mm-hmm.
So I'll stop there, but I think your work is really important. And I think, really appreciate hearing this today.
Thank you, Susan. And I so appreciate your comments. And I think back to when we initiated this survey, it was in the first and second wave. So this is where supports were, where families, we were all in that sort of stressful time where we were uncertain about many things. And a lot of these supports that families came to rely on needed to be different in many ways. So I think over time that the kind of delivery of services has evolved in many ways, both for families and for healthcare practitioners. And I think as we come out of this, hopefully, that those later ideas, as they were in that sort of delivery model longer, I'm hoping that we will come to those innovative ideas and models and a hybrid. Maybe it will be a hybrid, maybe it'll be something else. But I really feel that families, parents, and healthcare practitioners who've lived it are the ones to be at the forefront of this and to move whatever we as a community decide to go forward with.
Well, absolutely.
Innovative ideas.
Yeah, absolutely. And thanks. I'm glad I heard your talk. I'll get in touch with you.
Oh, please do. Yes.
Sarah asks, will there be data exploring quantitative impacts on health and well-being of these children and families due to home care disruptions? And she uses as an example increased emergency room visits or hospitalization, the need for more contact with the care team, phone or online, parents needing assistance with their own health, and there's a list could go quite on. That type of data she feels would be helpful to decision makers and funders.
I totally agree with what she's with the suggestion. Unfortunately, it's not part of this particular study, but I think though that those questions are important ones and should be considered for future evaluation. Absolutely.
And Lisa asks if there are resources or recommendations you would give to share with allied health providers like PT, OT, speech language to support patients and families. There's many who would be very interested in sharing them with their communities.
Certainly, that's a great question. And this is the presentation today is the preliminary data and our ideas that are coming from phase one. And certainly we are really eager and excited to complete the data analysis for phase two, because I think we will have a richer context and data from which to understand some of this information. And certainly for me, and the slide where I indicated that the going back to, I firmly believe that when I say the following, that COVID-19 and its ramifications led to significant disruptions in home care services, home care, that necessitated significant changes in home and work routines that had a significant impact on health and their important relationships. I know that those are only sentences, but these four elements of life for families and healthcare practitioners were quite important and quite powerful. I mean, for a parent to say that they were afraid that they may die and leave their child alone, it's just heartbreaking to hear. And certainly, the fear, the constant fear, anxiety, stress that families and healthcare practitioners expressed. We really need to think about how we are supporting families who care for these children 24/7, and how we provide them with supports and resources and respite. And I know I'm not saying. I know I'm speaking to the converted, and I know I'm sharing this with all of you that know this. But I think there needs to be more concerted effort, more funding, more supports around the delivery of home care services for this population of families and children, because the results are quite significant, even though they're only from a web-based survey. And that's why I'm really interested and excited to engage with families, health practitioners, stakeholders, and others as we move forward to think about what could be some important policy recommendations, and what could be some practice guidelines that we could be innovative and creative and work to put in place so that these families feel supported and have the resources and care supports and delivery of care and services that they need, and as well as healthcare practitioners.
We have two final questions. Patricia asks, are you going to follow up with the families? She's very interested in knowing if the families might become more resilient as time moves on, that they had strengths that had been previously untapped and actually sort of came through during the pandemic.
That's a really good question. We are currently, like I said, in the interview data analysis, and these interviews took place the fall of 2021 and early winter 2022. So we are currently doing the data analysis. But yes, I will be engaging with the members of the family advisory group, but certainly look to engage with any other important stakeholders or families or others who want to move this work forward. I think it takes a community and a village, and certainly we think there, you obviously feel there's important and necessary information with what I shared with you today and what we will learn upcoming. But it's really about creating momentum and the desire and commitment with families and healthcare practitioners to bring about the changes that we understand that are necessary to provide the supports and resources to families in this particular sector of the home care setting.
And the final question for today, can we also get data on financial impact on families to share? This is Kathy's question. Financial initiatives would be helpful for future pandemics in times of crisis, fire, floods, other natural disasters, such as were experienced in BC, in Alberta, and as climate change might suggest, we're going to see more of them.
Yeah, no, I think that's a really good question. And in this particular phase of this study, financial concerns didn't come through. And maybe that was because it was early in the pandemic experience. And obviously now we're in it long term. And I would suspect over time, there may be more financial issues. But certainly at the time that we collected this data, financial concerns or issues did not prominently showcase itself in the data.
And Karen, did anyone mention Jordan's principle throughout your study?
No.
Okay. Well, that's the end of our time today. I thank you for joining us, and I want to thank all of you for taking the time during what is a very busy period for all of you for joining us today, and especially thank Dr. LeGrow for sharing her time and expertise with us. We hope you depart with some practical knowledge to bring back to your organization. You can join us for our final Child Health Research Month webinar next week on March 30th with Dr. Bruce Carlton and Dr. Mike Ryder, who are presenting on Can We Protect Canadian Children from Unsafe Drugs? And then next Monday, March 28th, we'll also be releasing a new episode of Spark Conversations featuring Dr. Susa Bensler, titled Child Health and Wellness Research, a Priority to Transform Children's Healthcare. Next month, you can join us as well on April 6th when Kerry Robinson will be presenting on the Public Health Agency of Canada's approach to vaccine confidence in COVID and beyond, with a focus on children. It's always great if you watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our Knowledge Exchange network. Thanks again for joining us today. Thank you to Dr. Karen LeGrow for this presentation, and hopefully we'll see many of you back here next Wednesday. Bye, everyone.